Welcome to Hot Seat MD, a case conference review. The directions are simple. When the case appears, I will ask you to pause your media player. Then describe the study type and findings, give a brief differential diagnosis, and then check out the fast facts for additional information. Now pause your media player. This ultrasound image reveals at least 2 echogenic foci in the gallbladder with posterior shadowing. The differential diagnosis includes cholelithiasis, gallbladder polyp, although with a polyp you would likely be shown an image with blood flow in the lesion, and gallbladder carcinoma, although with carcinoma you would likely be shown an image with blood flow in the mass, and the mass may invade adjacent structures. Now pause your media player. Now pause your media player. Ultrasound and CT reveal a large, heterogeneously enhancing mass arising from the right kidney. Your differential diagnosis should include renal cell carcinoma, which would be most likely. Renal medullary carcinoma would be seen in young adults with sickle cell trait. Renal oncocytoma is associated with certain syndromes, including tuberous sclerosis, angiomyolipoma, which contain macroscopic fat, and hematoma. Now pause your media player. Ultrasound of the left adnexa reveals a complex cystic structure in the left ovary with lace-like reticular echoes. Regarding differential diagnosis, this is a fairly classic appearance for a hemorrhagic ovarian cyst. You could also include cystic ovarian neoplasm, although there are no papillary projections or nodular septa to suggest this, and endometrioma, although these are usually more homogeneous and decreased in echogenicity. Now pause your media player. Now pause your media player. Ultrasound images demonstrate multiple hypoechoic hepatic lesions, at least some of which are solid. Your differential diagnosis should include metastases, abscesses, and primary hepatic carcinoma with intrahepatic spread. Now pause your media player. Now pause your media player. The ultrasound image demonstrates a well-defined, homogeneously hyperechoic mass. CT images with contrast demonstrate a right hepatic lobe mass with peripheral enhancement initially, which fills in on delayed images. Regarding differential diagnosis, hemangioma is by far the most likely. You may also add hemangioendothelioma. Now pause your media player. Ultrasound image of the gallbladder demonstrates the so-called comet tail artifact. The diagnosis here is adenomyomatosis. There is no real differential here. Now pause your media player. Now pause your media player. Now pause your media player. Ultrasound reveals a heterogeneous soft tissue mass in the left adnexal region. CT confirms a soft tissue mass posterior to the uterus. Your differential diagnosis should include ovarian torsion. You can say teratoma, although there is no calcium or fat here to suggest this diagnosis. Also to be included are ovarian cancer and non-ovarian masses, such as a uterine fibroid, tubo-ovarian abscess, endometrioma, or ectopic pregnancy.